For identifying early signs of cancer, which supports the supporting early cancer diagnosis requirements of network DES, there are a few resources that are available for you. The first one that I want to talk about is our clinical safety alerts. Now, the clinical safety alerts have always been available within Ardens, so this is not new. And what these are doing is they're prompting if there are potential safety issues for your patients, and we're doing that in real time when you're entering information. So as an example, I've got a patient here who's age 60, and I'm diagnosing them with type 2 diabetes for the very first time. So what that will do is it will flag up the recommended NICE guidance based on the criteria for that patient. So we are flagging up where potentially there could be early signs of cancer for your patient, so that you can look into that and follow up on that patient urgently straight away, rather than you having to rely on running searches every so often. So these clinical safety warnings will pop up in real time, like I mentioned, for all staff within the practice, just depending on whether or not they're entering that particular criteria. And these clinical safety warnings, they follow the very latest cancer guidance, or the NICE cancer guidance, just as you can see there. And what we've done for you is we've put the recommendation of what you need to consider next within this box here. So it's clear and it's safe on what you need to do next. Now, we are constantly on top of making sure that we're following all of the latest NICE guidance. And as soon as there's any updates or changes that need to be made, we will make those straight away, and we will ensure that you're updated urgently. So we're always on top of this. And these clinical safety warnings are also reviewed by our clinical team. So they have a clinical input behind them as well. Now, you can access the full guidance if you wish by clicking on the link. But like I mentioned, we have summarized what needs to be done for that patient next. So looking at whether or not the patient has had any weight loss that you may want to rule out. Now, these cancer alerts will pop up as and when required, because when we deploy them to your system, we deploy them as active. So they'll be working straight away as soon as that information is being recorded in the record. And you can find them all in the background of the system. So if I go to the EMIS bubble and down to configuration, either you're going to be seeing a module that says template manager or a module that says resource publisher. And within that, you would then click on the Ardens folder under the protocols and templates area. And within the Ardens folder, there will be the clinical safety protocols. And there's a folder for cancer here. Now, the reason why I'm pointing this out, because it might be worth checking to make sure that they're definitely active. Although we deploy them active, you can deactivate them at practice level. So you may want to check that actually no one's deactivated it in the meantime, because these are really important to help you with your network DES work. So just make sure that they are active. You can see there that we have a few more reminders when it comes to cancer as well. So I showed you the new diabetes alert. We've also got high platelets alert. We've got a fit kit reminder alert, which we've just recently created. So they will all be there ready and working in the patient's record when needed to alert your staff.